Hey Sam, I've been trying to understand schizophrenia, but there are so many terms. Can you help me out? Of course, Alex. Let's start with the basics. Schizophrenia is a severe mental disorder that affects thinking, emotions, and behavior. It has different types of symptoms. Different types? Like what? We categorize them into positive symptoms, negative symptoms, cognitive symptoms, and affective symptoms. Wait, what do these mean? Let's break it down. Positive symptoms are additions to normal experiences, like hallucinations and delusions. Negative symptoms involve loss of normal functions, such as lack of motivation or emotion. Cognitive symptoms affect thinking, memory, and concentration. Affective symptoms involve mood changes, like depression. Got it? Tell me more about positive symptoms. Sure. Positive symptoms include hallucinations, delusions, disorganized thinking, and abnormal motor behavior. I know hallucinations are when someone sees or hears things that aren't there. But what about delusions? Delusions are false beliefs that don't change, even with evidence. There are different types. Persecutory delusions, thinking someone is out to harm you. Grandiose delusions, believing you have special powers or importance. Referential delusions, thinking random events are about you. Erotomanic delusions, believing someone, usually famous, is in love with you. Somatic delusions, false beliefs about your body, like thinking you have a disease. Whoa, that sounds intense. What about disorganized thinking? That's when thoughts don't connect logically. Some examples are loosening of associations, jumping between unrelated topics, tangential thinking, talking off topic and never answering the question, word salad, jumbled, nonsensical speech, neologisms, making up new words, clang associations, speaking in rhymes with no meaning. That must make conversations really confusing. And abnormal motor behavior, that includes catatonia, being motionless or having bizarre movements, stereotypies, repetitive, purposeless movements, echopraxia, copying other people's movements. Alright, now tell me about negative symptoms. Negative symptoms take away from a person's normal life, like, flat affect, lack of facial expressions or emotions, alogia, decreased speech, avolition, lack of motivation, and hedonia, inability to feel pleasure, asociality, social withdrawal. Okay, I think I understand the symptoms. How does schizophrenia progress over time? There are 3 phases. 1. Prodromal phase, subtle changes before full psychosis, like social withdrawal. 2. Active phase, full symptoms appear, including hallucinations and delusions. 3. Residual phase, symptoms lessen, but some impairments remain. I heard there used to be subtypes of schizophrenia. Are those still used? Good question. They're not officially used in DSM-5 anymore, but they used to include paranoid type, mostly delusions and hallucinations, disorganized type, severe disorganized speech and behavior, catatonic type, motor disturbances like catatonia, undifferentiated type, mixed symptoms without a clear subtype, residual type, fewer symptoms but still impaired. Are there any other disorders related to schizophrenia? Yes. Some related disorders include schizoaffective disorder, schizophrenia with mood disorder features, schizophreniform disorder, similar to schizophrenia but lasts 1-6 months, brief psychotic disorder, sudden psychotic symptoms lasting less than a month, delusional disorder, persistent delusions without other schizophrenia symptoms, shared psychotic disorder, folie à deux, 2 people sharing the same delusion. That's really interesting. How is schizophrenia treated? Treatment includes antipsychotic medications, like typical first-generation antipsychotics, older drugs like haloperidol, mainly blocking dopamine, atypical second-generation antipsychotics, newer drugs like clozapine, affecting dopamine and serotonin, cognitive behavioral therapy for psychosis, CBTP, helps manage symptoms, electroconvulsive therapy ECT, used in severe cases, psychosocial rehabilitation helps with social skills and daily functioning. Wow, schizophrenia is really complex. Thanks for explaining everything, Sam. No problem. I hope this helped you understand it better.